We're going to start by removing Sharon's former crowns, and I'm using a 880 Brasseler medium cut diamond. This is the same diamond that we'll be using for doing the preliminary preparation on the full crowns. We're going to cut through the porcelain first, making a slot on each crown, and then we'll go back in with a metal cutting burr to just go down to where the preparation is, and then spreading it and lifting it off. And one of the interesting things is when you're taking off former restorations is we try to place our burr into the positions that we would if we were doing our preparation. Now if this was a natural tooth, this would be the maximum depth that we would be placing our burrs. This is a 1.3 millimeter tip to that diamond, and that's about the size of the shoulder that we would want to have in our final preparation. And you can see I'm doing 2 planes of preparation, just as if we were doing this on a virgin tooth, but even with this amount of change, we've not come down to where the original preparation was. So just based upon this initial information, we're probably going to be doing a more extensive build-up on this tooth. Now we're going to move to a different burr. This is a metal cutting burr. This is the Great White 856 to start removing that thin metal coping. It's hard to tell at this point whether this is a precious or non-precious metal, and of course, as we all know, the non-precious can be much harder to cut through. So we find this burr to be quite helpful in these situations. The purpose here is just to gently spread this crown, not put any pressure on the tooth at all, so that we can just lift this off, preserving whatever is underneath. Okay, here we have our then former preparation that's underneath. You can see that they had used dowel core. There's quite a large composite margin here between where the dowel core was ending and where the tooth preparation was. And we'll take a look at the proportions from an incisal view. You can see the atraumatic way that I'd removed that, and that purple color now is because of what you're seeing here, all of this inflammation that is surrounding the crown. Now part of that is because of the depth of the margins, and that unfortunately is pretty well created right now. So in an ideal preparation, we would be undulating the margin so that we would be just beneath the tissue level, about a millimeter beneath, and then the preparation would rise in the interproximal area and then drop down. Now of course this was a traumatic accident, and she had had some tooth loss, which may have caused part of the indications for where these margins were placed. But as you look at the side of the dowel core, it looks as if it actually, was rising up here. And so this is really just representative of the older traditional concept, of having a more equigingival margin all around the tooth, which unfortunately placed these interproximal margins deep and then maintained this constant inflammation. So we'll be trying to go in smooth. We can't get back tooth structure that was lost, but we'll be going in smoothing this and then recreating a more idealized preparation. You can see the source of inflammation is once again in this interproximal cull area, where we seem to just get spontaneous bleeding, and then just even from the water spray, up in this area, we're getting, some bleeding that's going around. And you can see the increased vascularization completely surrounding this crown, which has obviously been an irritant, for the teeth. The other thing is to look at the shape of the preparation. We have a very teepeed preparation in some aspects, so we're not really following kind of the guidelines that would give the laboratory the most idealized positions for the restorative material that's going to be used. Looking at a 3/4 direction here from the lingual, you can also see that the reduction on the lingual is inadequate to provide space for the materials. And so what happens is these teeth tend to be over-contoured in this area, making either a metal show-through or an opaque, which porcelain show-through, which tends to be more abrasive to the teeth that are going to be occluding it. So we want to be sure that this particular area provides more space, and then we'll be building up some positions on the other.